All right, now that you all got to hear me have a sip from my icy cold water, I think we should get started. Looks like we've got a great handful of humans in the room today, and potentially more will slide in. And hopefully some of you are going to be watching this after we record it as well. We're going to share this after for people to enjoy. So thank you so much for joining us today for this episode of Connected Conversations, Ready for Change, Rethinking Behavior Change in Obesity Management. Our guest today is Dr. Dayna Lee Baggley, who is one of the best people in Canada to have this conversation with. And I will tell you more about her in just a second. But just to welcome everybody into the room and into what is called Connected Conversations. For those of you who may not joined a Connected Conversation before, this is a monthly series that is brought to you by Obesity Canada. In these conversations, we will dig into important topics for people living with obesity and with experts in the field. From advocating for access to evidence-based treatment, issues related to diet culture, weight bias, and discrimination, to innovating obesity care in Canada, these connected conversations will address the complexity of this chronic disease and the barriers that individuals living with obesity face every day. I'm one of your hosts. My name is Lisa Schaffer. For those of you that don't know me, I am a patient advocate and I am a member of the patient community. Professionally, I am a marketer in Vancouver. And for the last 5 years, it has been my pleasure to volunteer and serve Obesity Canada in the Public Engagement Committee. I work on advocacy with my partner in crime, Patton, who you'll meet in one second. And for us, we use our lived experiences to really try and amplify and change these conversations for those of us that live with this disease that is highly, highly stigmatized, misunderstood, and often really misrepresented. So we hope we're doing right by you. Ian, I'll let you introduce yourself.
Sure. Thanks for that, Lisa. For those of you that haven't met me before, my name is Ian Patton. I'm the Director of Advocacy and Public Engagement for Obesity Canada. Like Lisa, I'm a patient advocate. I've been involved in Obesity Canada since about 2008 when I was doing my graduate schooling. And I was a trainee volunteering with the organization. And over the years, I've turned that into a job where I am now. So this is something I'm incredibly passionate about. Like Lisa said, sharing our lived experience and advocating for access to care and the elimination of weight bias and discrimination are all things that get me going in the morning. So I'm excited to be here. I'm excited about this webinar. And I think the one thing I was going to say is that these webinars that we've been doing, this Connected Conversation series, is kind of an extension of the work that came out of the release of the clinical practice guidelines that were launched in 2020. And so this is a way of us kind of getting that knowledge out there, digging deeper into some of the topics that came out of those that work, and hopefully we can start making some noise and taking those guidelines and putting them into practice, I think, is the next step. And so these conversations are an important way of doing that. And I'm really happy to be here. So with that, there is a little bit of housekeeping for today's webinar. Some of you have noticed there is a chat feature that you can use. Keep the conversation going there. You can connect with each other. You can post comments and questions and things like that. But if you have specific questions that you'd like us to try and address during the webinar, please utilize the Q&A feature. You'll see that down in the menu on the bottom there. And if you do that, you can look at the questions that have already been posted. You can upvote the ones that are up there so you don't have to duplicate questions. But we'll monitor that and we'll try and get to as many of those questions as possible throughout. And if we don't happen to get to your question, don't worry about it. We keep track of them and we try and address them after the fact in other ways. So whether it's, something we bring up in another article or we address in another webinar, it informs us on where we need to go and what's important. So don't worry about that. And with that, I will pass it off back to Lisa.
Awesome. Thank you so much. So excited to get this started. Excited to see what questions you guys throw into the question and answer box as well, so that we can help that guide our conversation. But let me introduce you to someone that I think is going to really make a difference in your day today. So Ready for Change Management, Rethinking Behavior Change in Obesity Management. Dr. Dayna Lee Baggley, PhD, Registered Psychologist, is a registered clinical psychologist who specializes in clinical interventions, training for healthcare providers, and research in behavior change, obesity, chronic disease, professional resiliency, and acceptance and commitment therapy. She is the author of a book called Healthy Habits Suck: How to Get Off the Couch and Live a Healthy Life, even if you don't want to. Highly recommend. Please read this book. It's a great one. Welcome, Dr. Lee Baggley. Yay.
Thank you for having me.
Pause for Muppet applause. So as I mentioned at the top, and as you and I were just chatting a little bit before, I am super excited to have this conversation with you. I genuinely feel you are one of the best people in Canada to have this conversation with, and I'm excited for more people to have exposure to the work you're doing. I have been fortunate, and we have been fortunate at Obesity Canada to have you as a speaker at events in the past. And one of the things that I've always really appreciated about anything that I've interacted with you on is how genuine you are. As a healthcare provider, it really does make a difference. And it's something I think that really separates you from the pack. I really appreciate that you walk the walk, you share your personal experiences. And in preparation for today, I was looking at a drleebagley.com. Hopefully site traffic goes through the roof now. And something that stood out to me was your mission. Our mission is to reduce human suffering, bring people together, and increase access to science-based information. I love the simplicity of this. I love that you talk about human connection and increasing joy. So why don't you introduce yourself a little bit to everybody and maybe tell us a little bit about how you got into working in this space, especially as it relates to the obesity care.
Sure. So I'm in Halifax, Nova Scotia, and I'm a registered psychologist actually in Nova Scotia, Ontario, Alberta, and BC. And so I now do a lot of virtual interventions across Canada. I worked in the healthcare system on the medical, surgical, and cancer care units for almost 15 years and was there for wave 1 and wave 2 of the pandemic. I was working in the cancer center there. I worked on the surgery teams as well for a long time. And so I was involved in the bariatric surgery teams, for example. So basically, I'm a health psychologist. And so I work with people who have chronic disease or life-threatening disease. And one of the things I really like working on is kind of new areas. And one of the things that we really were doing terribly and needed to do a lot better on, and there was a lot of, ways we could go, was on obesity and on weight management. And so it was a really interesting place for me to be because there's so much psychology in every single health condition. This distinction we've made between like mental and physical health is not one that our bodies actually make. Like our bodies don't think that they're different things. So the place in our brain that stores physical pain is also the same place it stores social emotional pain. So when you get rejected, that pain is stored in the same place as if you broke your leg. So our brains do not distinguish these things as being separate things. And so psychology impacts every single health condition we know of. And so that's what I like about the work, is being able to add something that I think really helps people cope better and live better with often some really difficult situations and conditions. The way the clinic came about was that I was working in the hospital during wave 1 and wave 2 of the pandemic, and for my own burnout reasons, left after wave 2. And it was actually partly a value-driven reason. And what I've said to lots of people during the pandemic is, don't just get away from something bad, move towards something that matters. And so what mattered for me was that I felt like there were new things that I needed to do. This saying I've come up with is, who do you want to be in the apocalypse? It kind of feels like the apocalypse, and I can't quite convince myself it's not the apocalypse. So it's a better question of, who do you want to be in the apocalypse? And that there were things I needed to do and contribute to the world that wasn't at the hospital anymore, that I needed to do that elsewhere. And in part because the needs had actually gone up so much because of the pandemic. And so that's where the virtual clinic came about. We specialize in treatments for individuals with chronic disease. We do a lot of group therapies, one, because it brings people together, but two, it also reduces the cost for people and increases access for care. So it's more manageable, and you have a lot of moments of people saying, yep, I've experienced the same thing. And so we know from the research literature, there's a benefit to group interventions because you get that added social support. And then the other thing that we specialize in is actually treatment for healthcare providers. So physicians, nurses, we do a lot of work. I'm also on faculty in industrial organizational psychology at St. Mary's University. And so we do a lot of work on healthy workplaces and kind of organizational factors that impact things like burnout and mental well-being, and kind of leveraging the workplace as a resource for health. So one of our big kind of things is that, burnout has been largely described as like an individual problem that is treated with like more self-care. But frankly, I was like, I am not going to tell, healthcare workers that they just need to do more yoga and they just are not doing enough mindfulness. And this is the problem, having lived through wave 1 and wave 2 of the pandemic at the hospital. And so there are actually a lot of organizational factors that lead to burnout, and organizations actually are responsible for addressing those system level problems. And so we have a number of interventions where we got funding during the pandemic that was actually about treating system level problems for burnout. So treating, interventions for leaders, organizational factors that can improve people's health. And so that's part of, again, kind of trying to have more impact and trying to increase access to science-based information. There are a lot of things we know workplaces could and should be doing to improve mental health in employees, and trying to help employees do that.
That's so cool. And again, to me, that's a reflection of somebody who's embracing a moment. We're obviously all answering questions we never thought we had to answer before. And I think Ian and I are also helpful that maybe one silver lining that might come out of this pandemic era is the change and embracing of these new ways of providing virtual care and ways for people living with obesity to show up and get care where they maybe couldn't before because they literally did not feel okay to leave the house or even walk into that doctor's office. To me, there's an opportunity here. So I love that you're someone who's embraced this moment.
And we were doing interventions like via phone and via internet before the pandemic started, for those reasons of trying to increase access. And so it was, a continuation of that, but it became much more acceptable both for like healthcare providers and for, patients or recipients of care to do that virtually, which is, why I suddenly got registered in BC, which is clearly I will never see them in person. It's always going to be virtual, but it became acceptable. And I do hope that increases access to care.
Absolutely. So let's hone in on kind of that behavior change as it relates to obesity management. We all know that behaviors like eating healthy, living that active lifestyle are important to health and well-being for any human, whether you're living with obesity or not. But these healthful behaviors are also an important piece of chronic disease management and that puzzle of anybody who has a chronic disease and trying to figure out how do I keep myself as healthy as possible within this new definition of who I am. Yet when we get into the world of obesity, they kind of become those specific behaviors of diet and exercise suddenly become the whole puzzle for a lot of people. And we know that isn't true. I know Ian and I have shared our personal experiences of navigating life with obesity and how mentally exhausting it really can be. We are so bombarded with these messages, lies, as I like to call them rather, that weight is the best reflection of health and that it's really easy to change your weight with diet and exercise. And there's many of us that tuck in and we try really hard and we do that hard work of showing up for ourselves and counting our 10 almonds for our snack that day and dedicated to my workout. But because we have the incorrect metric, it really you get burned out really quickly in trying to adopt these healthy habits. So we stop. At least I know that has been part of my experience. So let's talk about that science of behavior change, that expectation that we put on ourselves, all that good stuff that you are fantastic at ringing my bell.
So I like to say that, the move more, eat less is not an evidence-based intervention. It actually has been shown to not work for like 95 to 99% of people because you can lose weight that way, but it is very unlikely that you're going to have sustained significant weight loss just through diet and exercise. And so there is no other, health condition where if the treatment didn't work for 95% of people that we would continue to recommend it. And it's because of the biases we have about weight and the myths we have about weight, that it is way more controllable than it actually is. And so as we, hopefully as we learn more about the science of weight management, we come up with better interventions. That's certainly the pillar kind of model from Obesity Canada, I think captures that a lot better, that you do in fact need to do health behaviors, but those are supported by the pillars of either surgery, medication, or psychological therapy, or some combination thereof. And that those are the actual interventions, not that the like diet and exercise. People also kind of overemphasize diet and exercise when we actually know there are like a ton of other things that influence weight, including things like stress management and sleep and all of these things. So we know if you have more cortisol in your body, that it's harder to lose weight. And cortisol is a stress hormone. So anyone feeling stressed about living through the pandemic, that happened to anyone? So even if you somehow could keep all of your in and out kind of the same, which most people can't under stress, your body still wouldn't lose weight. It would hold on to weight more when you're under stress. And again, that's actually an adaptive thing for humans, because starving to death has been a threat to the human species forever, and it continues to be. As we are speaking, there are people starving to death on the planet. This is not a problem humans have solved. And so Mother Nature doesn't let us make decisions about things that are life-saving, right? You don't get to choose about breathing. It is an automatic process. You cannot hold your breath long enough to suffocate yourself to death. Your brain will override that. You cannot, so Mother Nature takes over these things that are really important to survival. And that includes, weight management, that includes set points, that includes metabolism, all to make sure that we're not starving to death. So I like to say that it's not abnormal to put on extra weight. What's abnormal is living in a world where you can have a full day's worth of calories in a single Starbucks cup. That's what's abnormal. When bodies put on weight, they are doing exactly what millions of years of evolution have designed them to do. There's just a huge mismatch between how our bodies work and the modern world we live in. And frankly, even when you see some people, I've seen people who've got COVID and ended up in the hospital, and having some extra weight on them actually was helpful, because when you're that sick, they actually used up those reserves. When we were in the hospital, if somebody was underweight, it was a much bigger problem than people being overweight, because they could use up some of those reserves when they were in the hospital, when they weren't eating, when their bodies were trying to recover, and it was actually protective for them. It was a much bigger problem if they were underweight. And so again, I hope that we get smarter about the way these things work, so that we can help people not just work harder, but actually work smarter. People spend a lot of time trying to do the same thing, but harder or better or longer or more. And most of our interventions are about, how do we do something totally different that's going to help you in the long run, but it's sort of a side effect. Weight management is a side effect of living a meaningful, purposeful life. It's not the intent. Because I like to say there are a lot of skinny people who are totally miserable and not living meaningful and purposeful lives. And so just helping you manage your weight doesn't mean you're going to live a meaningful life. And that's part of our mission, in our clinic and with my work, is to help people live more meaningful, purposeful, joyful lives. Managing your health will always contribute to that. But that's not the in of itself. It's not health for the sake of health. It is health for the sake of doing things that matter to you, connecting with people who are important to you, contributing to the world in a way that matters to you.
That is super powerful. I just want to take a second. Because I feel like that's really, really powerful. That health for health's sake not being the thing, and health for the sake of those things that are going to bring joy and that life that I want to live. That is huge. Or at least for me, it feels really huge, because I know for many years I operated under the auspice of A, I'm not healthy, which actually I was quite healthy. And B, like, I'm doing this because I need to be compliant to that. I actually had detached myself from that outcome even, and it was more about pleasing. Oh, wow. You just broke my brain a little bit. Sorry, Ian, I saw you come off mute as well.
Yeah, no, it was one of those moments where it's like, yes, exactly what I experienced as well. And like, I was someone who, I was an athlete. I was pretty active growing up and things like that. But when I got really sick and obesity, kind of took over my life, I was doing exercise, and I'm a kinesiologist and an exercise physiologist, and I know this world really well, but I was doing those things for the sole purpose of losing weight, and it never ever stuck. No matter how long or how hard I tried, there was always an end point there, because I couldn't keep it up. Like the motivation, the purpose of it was wrong. When I started treating my obesity properly, and I started looking at exercise and being active and the healthful behaviors that I was doing more for this purpose, being able to do the things that I want to do and not, focusing specifically on weight loss, I became a runner. I started running regularly and I enjoyed it. And as a heavyweight wrestler back in my college years, my university years, running was foreign to me, not something I would ever have considered myself. But it just changed that whole mindset, and it allowed me to actually enjoy it for a whole other purpose and completely detached it away from weight.
And that's the kind of thing that we need people to do, is to connect it with some like higher order, like sense of meaning or purpose about who you want to be, about, what matters to you, how you want to connect to people, contribute to the world. Because the real challenge in weight management is the sustained behavior change, right? Typically, people who are struggling with their weight have actually lost hundreds of pounds, and way more than someone who has been stable weight but thin. It's just that you've regained it. And that's, again, millions of years of evolution, making sure that you don't starve to death. I often say, those skinny girls in the magazines, they don't make it through a long winter. They're not getting through a famine, right? It's actually not adaptive from like a survival perspective. And so we're trying to link to those like sense of meaning and purpose rather than some goal weight or because you have to. And again, we actually as humans need to be working towards something that matters, not getting away from something bad. And a lot of the messaging about weight is bad things will happen to you if you don't manage your weight. You're going to have a heart attack. You're going to have cancer. You're going to have all these bad things. And I remember one of my clients saying, she was like, she had cancer and she was in remission. And she said, well, I want to start walking because I know that would be good to like prevent my cancer from coming back. And she's like, so shouldn't I think about cancer all the time? So I'll go walking. And I'm like, no, who would want to think about cancer all the time when you're in remission? If you link cancer and walking, you're never going to want to walk because who wants to think about cancer? And so, but that's often, I have to avoid a heart attack. I have to avoid these bad things that are going to happen to me if I don't manage my weight. And so instead, we linked walking to being the mom she wanted to be, being more clear-minded or more patient, that she was going for walks to connect with her kids better. That's a moving towards something that matters and not a getting away from something bad. The getting away from something bad will start behavior change, but it will never sustain behavior change. And so, the example I give is, if I ask myself, do you want to go to the gym? The answer is no, I don't. It's all effortful and sweaty and hard work. So that's not the question I ask myself. The question is, do you want to go to the gym or do you want to yell at your kid at bedtime? Because actually going to the gym makes me a better mom. It makes me more patient, more clear-headed. In the pandemic, it's actually become really necessary as like anxiety management and like cognitive processes to exercise like really regularly. And so I have to link it to those factors, about being the parent I want to be, being the therapist I want to be, presenting, these kinds of things are the things that then motivate me to go because, again, I don't actually like the gym, right? It serves me show up as the person I want to be.
And I think that's really big. And that's something that I enjoyed from your book. And I think another podcast that I heard you speaking on as well. It's just refreshing to also hear this, that, it's okay to feel yuck and still go. In its simplest form, I think I heard you say that along the way. And I just love that because there's something to that as well. I also, I took up running, walking, let's be honest, it started with walking and then my version of a run. I've done 5, 10 and half marathon, 1 half marathon I have accomplished. But it was yuck the whole way through, but I showed up and I saw something through all the way to the end. And that was the win that I moved into. And that's why I kept going. And I think that's really powerful as well.
So I remember being on a panel and, saying like, it's okay if you don't find exercise, like often the message is find something you like. And if you can find exercise you like, that's awesome, go for it. But if you can't find exercise you like, it's actually okay to do it anyway, because again, it's helping you be the person you want to be in this world. And I remember there was a physician on the panel with me, and afterwards they said, I think there actually are some people who enjoy exercise. And I was like, yeah, they probably are, but they're not the people you're trying to convince to exercise. They're already out exercising. The ones who are not exercising think that they're supposed to love it, think that they're supposed to enjoy every moment of it. And actually, it's probably pretty miserable for the actual exertion part of it, but it's helping you do things that matter to you. And it
Mhm.
was really illuminating to me because I was in a running club like before the pandemic. And there was this man I was running with. He was like in his 70s. He'd taken up running in his 50s. He ran a whole number of marathons, always won in his age group, right? Because they divided up by age. So we always won. And he said, oh, I don't actually enjoy running. And I was like, what? And I mean, this man was running like 24K that day. And I was like, could you slow down? You're running too fast for me. I was only running like 5K. And he said, no, I don't enjoy the act of putting one foot in front of the other. He's like, but I really love being a runner. And for him, it was actually about competition. For him, it was another way he could compete. And again, he could compete in his age group and was often at the top. Told some story about thinking this 80-year-old in his age category had cheated on one of the races, and he was like pissed off about it, like
Love
because
it.
that was the value for him, was about competing and challenging himself, right? And so it was really helpful for me to realize that like he didn't actually like running either, but there were all these other things about running that mattered to him.
That is, yeah. I love that. It's not, it again seems so simple, but it's there. Like it's just there. We need to have the right connection to our core values for things to be sticky and for us to want to get out of bed and go to a 6 a.m. If
Exactly.
nothing else will wedge me out of bed, that connection to who I really want to be can definitely help in that moment. I love that. The
And
other part that I really enjoy in reading the Healthy Habits Suck book is that idea around it's kind of my job to do the healthy behavior and then separating what my body does afterwards. Because I think that's the other thing that people who are living with obesity have done in this moment for a really long time is I believe I can control this moment and my body.
yeah. And it's a really sad and frustrating and untrue thing that we teach people in our culture, that we give people this myth that we have more control over our bodies than we do. So one of the sayings I hate in life is, if you just believe in your dreams, anything is possible, right? When they have that in kids movies, and when my kid is watching like a intro or something, I'm like, that's not true, right? It's total bullshit, right? Like, this, right? Because what that message says is that, it blames the individual, and that and the reason if you don't succeed as an individual in whatever you're trying for, it's your fault. And if you had just tried harder, you could have succeeded. And that completely ignores environmental factors. It completely ignores systemic factors, why some people get ahead and some people don't. And it actually ignores the biology of humans, which is none of us in this moment could change our blood pressure on purpose. We couldn't change our blood sugars on purpose. And there's no believing in our dreams that are going to make us like grow another foot tall. It just doesn't. We've somehow, unfortunately given people the message that they can control their bodies to a much larger extent than we actually can. And it shows up in all kinds of subtle ways. So the other subtle way we do it is about battling cancer, right? People lost their battle against cancer because it makes it sound like if you had just tried harder, you could have won, right? When actually people get diagnosed with cancer, they get treatment for cancer, and they sometimes die from cancer. Yes. And you can be doing everything right, and you can still die from cancer. And many people actually will live 5, 10, 15 years past their initial cancer diagnosis, right? But we've taught people that we have more control than we do, and we don't. And so this is sometimes, that I'm kind of the bearer of bad news, but I'm like, no, you actually can't have a model's body. It doesn't matter how hard you try, your body's not going to look like that. I realize that about runners too, when runners are so like svelte, Yep. But I don't actually think it's because running makes them thin. I think it's that thin people keep running, because I also did a bunch of 10Ks. I did 1 half marathon. My body is not made for long distance running. I had to go to physio or to massage therapy every week because I was getting overuse and injuries, because that's not what my body. And so it's not something I would do long term. And it's the same thing as like playing basketball doesn't make basketball players tall. It's that tall people play basketball, right? Thin people run because it's less hard on their bodies than for people who are bigger. And we don't have that much control over the shape of our bodies. Now, there are definitely things we can and should do. We should always invest in our health. That is always a great investment in your physical health and your mental health, right? And it is a useful and necessary thing. As most people age, they have to put more effort and intention into managing their health and investing in that. And you absolutely should. But you can do everything right and things can still be going wrong. You know, when people have a chronic disease, you can be doing everything right and it can still be going, wrong. You can, if you have chronic pain, you can be doing all the right things and your pain can still be unmanageable. Your illness can still progress. Your weight can still go up, even when you're doing everything right. And it's not because you're not trying hard enough. It's because we don't actually have that much control over our bodies. And so this is, again, to me, let's make more appropriate goals for people, make behavioral goals instead of outcome goals, because we can control our behavior to a much larger extent than we can our bodies and our physiology. And it's like, really, you're going up against millions of years of evolution. Guess who's going to win? Not you, right?
Not this girl.
Yeah.
And I think that's really huge. So I'm just going to take a pause there as well, because I know my personal experience, I had, dedicated years, it feels like decades of my life trying to be this super hyper compliant person. I then, in my mindset back then, went, okay, I guess I am going extreme of exploring surgery, weight loss surgery, which was a huge step for me because I still had this belief in my head. It was just about me not doing enough. And so that I was acquiescing and taking a shortcut. I now know that to be so not true. And that actually, I had a gastric sleeve surgery. I had some loss, but not that loss that I really thought I deserved, let's be honest. And that's when I finally connected all these dots and met Ian and met Obesity Canada and went, oh my gosh, I was so wrong for so many years. And that was another hurdle that I needed to navigate, because living with obesity had taught me to be a perfectionist and to please people in every way possible because I was so displeasing in a fundamental way. So then to go, oh man, I was even wrong about that. Took a minute. So I'd like to just talk about that for a second, that kind of stigma that we feel around this obesity moment, stigma around even asking for that mental health moment, because in all honesty, what you're saying should be incredibly sane making for everybody's ears that it is reaching. And I hope it is, because that is so true. It is so true. And we have lived for so many years under a false pretense. I don't even know if there's a question in there, but I'm going to
Yeah. I mean, I would say that, we have, again, this notion in dominant Western culture that the best version of a human is somebody who's independent, who can do things on their own, who is like self-soothing, who can, achieve their dreams. But actually, it's not true. That the best version of a human is somebody who is connected to a supportive, like engaged village. And I like to say, the people who don't care what other people think, they're psychopaths. So it's actually a really normal human thing. And the best version of a human is actually one who's connected. This focus on independence is a much bigger thing in Western culture, not nearly as like in other cultures around the world. Our obsession about happiness, right? Again, I often say that happiness is a terrible life goal because you can't make yourself happy and you can't keep yourself happy. You can absolutely have a life goal to have meaning and purpose and connection, because those are things we have control over. And I often tell the story about my grandmother, who's Chinese and grew up in like rural China. Let me tell you, she had no expectation of being happy in her life. She struggled through many things, got all of her children immigrated to, North America. But that was a lot of sacrifice and a lot of hardship. And, if I had said to her, she's passed away now, but if I had said to her, Grandma, I just want to be happy, I was like, she would have smacked me. She would have been so like disgusted with me that was my life goal because it was meaningless to her. And I said that to my sister, and my sister goes, oh, she would have spit on you. Like she just is not a thing for other cultures, this obsession with happiness and independence. And so this is what I think is about. We definitely have challenges asking for and accepting help, and we all run into those struggles. But the best version of a human is one who has a village of support, and we benefit so much from using other people's skills and expertise and knowledge and strength. And that is how you make a stronger human, is not making yourself stronger, but being able to rely on a whole bunch of other people. It's not a net loss. People are like, I don't want to be a burden to somebody, But I often say like, well, have you ever had the experience where you helped somebody and it made you feel good? And they're like, well, yeah. I'm like, well, you're denying other people that chance. When you don't ask for and accept their help, you're not giving them the chance to feel good to help. It is not a net loss. Just because they help you doesn't mean they have less. Chances are they have more because they actually feel good about being able to help you. And so the asking for and accepting help, whether that's for medical, things, whether that's for mental health, was a barrier for lots of us. And but it's one that we work on to make that village of support, which biological relatives means you need to invite other people into your village, which can include healthcare providers, right? They can be part of your village. And especially if you're struggling with obesity, you also want to have a village that gives the right messages, that says the right things, because says evidence-based things, because you'll hear the other version thousands of times in all kinds of subtle ways in our culture.
And even not so subtle ways. Sorry.
Yeah,
Exactly.
I'm going to jump in, and I want to kind of circle back to a little bit earlier when you were talking about kind of getting into like the complexity and the things that we, controlling the things we can control, and how complex there's certain things about obesity that we can't control with our behaviors and stuff like that. So there's a question that popped up from Corinne that I do want to address here. Because I think what we got from the clinical practice guidelines and all the work that's been done in the obesity world in the last little while is that it is incredibly complex, and there's no singular solution. The stuff that we got out of the guidelines was that these evidence-based treatments and things that we have available should be used in conjunction with each other, not one or the other. And so like the sentiment and the stigma around specific treatments like medications or bariatric surgery, those being considered the easy way out. They're certainly not the easy way out. They might not be the right choice for everyone, but maybe can you talk a little bit about how psychological interventions can complement and works together with certain things? Like Corinne's kind of point that she made here was more about, doctors are pushing obesity medications and we should rather be trying to focus more on psychological therapies. And my thought is that it's more like it's not one or the other. They kind of supplement and work with each other.
Yeah. So, chronic disease in general is this balance between you want to do everything possible you can to be as healthy as possible. And there absolutely are things that we do that impact health, diet, exercise, meditation, stress management, sleep. These are things that influence our bodies and our health. And so we should absolutely invest in those things. We balance that with the acknowledgement that you can be doing everything right and your illness can still have its own course. And so it's an and instead of a but, right? For me, as a psychologist who's always helping people with the health behaviors, medication can be a real gift, because basically what we know, from studies is, for example, if you've gained and lost weight, your brain will respond differently to food cues than someone who's been stable weight. And so your experience of a craving is actually bigger than somebody who's been stable weight. And what medication can do, or surgery, is get you back into a range where you have a chance of using psychological skills. So to me, medication we use so that it makes it easier to engage in your health behaviors and you're more likely to stick with them over time. Because there actually are changes, in our brains that happen. Basically for our brain, every time we lose weight, it's like, oh no, there's a famine. Oh no, right? And so it sets up all these things to make sure we don't starve to death. Medication and surgery can help us balance those things out so you have a fighting chance, because the cravings you're dealing with if you are living with obesity may actually fundamentally be bigger than the cravings from somebody who's been stable weight. You're not battling the same battle, right? And to me, that's the same thing for anxiety, for depression. If you have an anxiety disorder, your anxiety is fundamentally bigger than it is for somebody who doesn't have an anxiety disorder. And medication by itself will not do a damn thing, but medication plus psychotherapy will make it easier to engage in the psychological techniques and to stick with them over time. And so we all use modern science, to live longer. If you have ever taken an antibiotic, right? our life expectancy was 40 before the invention of antibiotics, because you would get, cut by something and you get gangrene and die. And so we all benefit from modern science to live longer. And if we can use medications to improve people's quality of life, to again allow them to do things that matter to them, that are helpful, that are meaningful and purposeful, that is a great use of modern science. And so my experience of it is always different, because I'm never the person giving the medication, but it can be really helpful for people to get medication along with psychotherapy, because it makes it more of a fighting chance that you can use these psychological principles and stick with them over time.
Yeah, and I think, going back to the pillars comment that you made earlier with the clinical practice guidelines and that image that we have of the pillars, kind of positioning the behavioral stuff, the physical activity and the nutrition and those sorts of things on top of the pillars, and the pillars are holding up and supporting those behaviors. It's kind of an indication that those treatments, the psychological interventions, the surgery, the medications that we know about, those things allow people to be more successful with the behavioral interventions, and kind of gets at that whole, being able to do those longer and more frequently and enjoy them more.
Yeah.
So.
And to me, again, it's not the same competition. Do you know what I mean? Like, the thing you're struggling with is not the same thing as someone who's been stable weight, who hasn't had their weight go up and down. And that's, to me, it's like, it's just getting you in the same range of the kinds of cravings they deal with. Like, you're fundamentally, from a biological, neurological state, experiencing a bigger craving, a more intense craving than somebody else.
And that's a huge part of this. And again, shout out to the clinical practice guidelines. We really do need people to help.
Oh, did we?
There we go. Lack of willpower.
Yeah. And that's what, a lot of those medications do, is they are impacting your brain. And again, if the message is just work harder, that's a terrible message. We want to help people work smarter, to understand how our brains work, how our bodies work, to make use of the science of behavior change, the science of biology, to be more successful at that, not because you're trying harder, but because you're being smarter about it, about, dealing with the realities of how our bodies work.
And smarter equals informed. That's my other piece that I will say to everybody, because as somebody who has had, really amazing care and treatment, I have seen a difference in my body, as have other people. And when people compliment me, that could be a whole episode unto itself. But when people compliment me in that moment, my go-to right now is like, thank you. I am receiving the right care for the disease I live with, and I feel healthy. Like, that's my focus in my response, even just to try and help other people get that this isn't just about I'm wearing a smaller size pant, because it really isn't about that. And I know that's really hard for some people to hear, or some people might hear that it might bounce right off. I would have been that lady too back in the day. I get it. But it's a really large shift. And I know Dayna had a comment or a question here. Ian, were you going to move to that one as well? Because I feel like it kind of ties in.
You can go for it.
Okay, groovy. I'm just going to read the question directly. So, I appreciate the idea of focusing on a meaningful, happy, productive life. How do you manage the highly destructive impact of weight stigma in that work? For example, I manage my own health and meaning in my life. I love working out and being active. That's fun for me, and I spend a lot of energy finding ways of doing it more. But I'm literally abused with most interactions with healthcare professionals, not to mention stigma in daily life, in my employment, etc. This is one of the biggest stressors in my life and has a significant negative impact on my health.
Yeah. So, first, you're absolutely right. Like, stigma really does exist. This is not in your head. There's all kinds of studies demonstrating that this stigma and discrimination really exists. Again, it's one of like the last acceptable discriminations, where you're allowed to make fat jokes, but you can't make other jokes about other attributes. And so it is a reality that impacts people's mental health, right, and their experience of life. And so, again, there are some interventions that have been done. A really interesting one was that it was an intervention done on weight stigma for individuals experiencing who were living with obesity. And the impact of the intervention was that their quality of life went up, right, and their weight went down. But the intervention did not discuss weight management whatsoever. It just talked about managing the stigma of like anti-weight bias. So, but honestly, this is why I do things like, interventions in the workplace and training healthcare providers, right? My research at Dalhousie is about behavior change in chronic disease, but it's both behavior change in patients and behavior change in healthcare providers. Because if we don't start treating the environment, it doesn't matter how hard you try. And that's exactly, Dayna's point, is that you can only do so much. And if you're in a toxic environment, it will still impact you. And so, that is why I do those other things and try to address system level change, because it's a reality, and those things need changing as well.
I think that's really important. And that's another benefit to me of the clinical practice guidelines. We're really trying to go from a top down and bottom up approach, meaning we're trying to make this as approachable for those of us living with obesity. So A, we can wrap our head around it. And then B, we can feel empowered to take this information with us when we go and ask for help, or when I just go to a regular doctor's appointment, if I feel that bias or stigma presenting itself, helping people feel a little bit more empowered to have the right conversation, and knowing that you can say, actually, I don't need to be weighed today because I'm not here to talk about my weight. I'm here to talk about X, Y, or Z. And I think that's a really important moment of the clinical practice guidelines too, because we're trying to teach the healthcare professionals new information. And I keep saying this on repeat as well. We need to make it okay for people to be wrong, to have been wrong. See my previous example of how I felt for years, and then going, what? I can't be wrong. I refuse to believe this, even though it was the thing that was going to make the difference, right? So helping people navigate this change, because when we learn more from science, things evolve. It's not that science lied before.
Exactly. And, I actually think self-compassion and compassion is a really critical skill in all of this, because it's about that it's okay to make mistakes, and we will make mistakes, and everyone's going to make mistakes. And, to me, what's wrong with cancel culture is that then it's not safe to make mistakes. And that's the only way we can learn, is if we make mistakes. Now, clearly there are some behaviors that are unacceptable, and people should not be in positions of power, but we also need to be able to make mistakes when we learn, and that we are just humans, and so we will make mistakes and we will have setbacks. And there's lots of research showing that when we can respond to setbacks with kindness and compassion, that it actually improves the likelihood of getting back on the wagon, right? And that's what we're using self-compassion for. Sometimes people are like, well, isn't that just an excuse? Aren't I just excusing bad behavior? If you're using self-compassion to allow yourself to do more harmful things to your body, like eating crappy foods that, again, are readily available in your environment, that's not self-compassion, that's self-indulgence. And self-indulgence, by definition, is doing something to the point where it's harmful to yourself. Self-compassion is always in the service of making, a choice towards your values, towards what matters. That's what we use self-compassion for. But it's recognizing that we will make mistakes. And usually when it comes to mistakes related to weight management, you're just being a normal human. Sorry to be the one to tell you, but you are a normal human.
No,
right?
it's so true. And you were listening to your own brain and your own body. And that's the other part I know I personally experienced as well, is I was believing the magazines before my own body. And that was a moment where I really felt like I can now see how much I had lost myself and the connection to self and how important that is. So I love that self-compassion versus self-indulgence. I think that's perfect. I think it's also a lovely segue to kind of just the last little bit I'd like to talk about, which is the fact that we're living through a global pandemic while living with a chronic disease, while trying to embrace healthy habits that you've told me suck.
Yeah.
How can we help people understand this intense moment that we really are living through right now?
Yeah. So, I really think it's important, the self-compassion is really important in the pandemic. Basically, to make healthy choices, you're using your prefrontal cortex, which is, the location of self-control, of willpower, of executive functioning, planning, decision-making. But it's like a battery. And so we'll use up that battery of self-control. And basically, there's a whole bunch of that battery that now has to go towards the pandemic, and the pandemic that won't ever end. It just keeps going. And so I also would love to be someone that if we could just pretend it wasn't happening, it would make it go away. I would be all for that if it made it go away. It doesn't make it go away. It is still weighing on all of us. And had this been World War III, we would have abandoned all kinds of expectations and just focused on the war effort. That actually would have helped us balance our stress levels, because there would be all kinds of things we just would never expect to do in the middle of a war. But in the pandemic, we've just added the stress of the pandemic onto the stress of everyday life. So we absolutely expect health behaviors to fall apart because they require frontal lobe battery, and everyone has to use some of that to manage the pandemic in all kinds of different ways. And it also increases our sense of threat, because there is this threat that we can't control, that is unpredictable. And you don't have to be consciously aware of that threat for that system to activate, again, to like pump your body full of cortisol. And so those are not choices that we make. Those are the physiology, the biology, the neurology of humans. And so we do want to be kind to ourselves. Sometimes staying steady is a win. Surviving is a win. This may not. I was really annoyed with, insulted by notions that like lockdown was a great time to learn a new language or pick up a new skill. It was not. We were just surviving. And, you wouldn't expect yourself to like clean out all your closets in the middle of the London Blitz either. You know what I'm saying? So, we just had really terrible messages and expectations for what we can do. And it's especially a time because of the pandemic to think about what really matters. Right? We can use this, again, who do you want to be in the apocalypse, right? You can use this as an opportunity to figure out what really matters to you, what's really important to you. And for most people, that's about connection and contribution, right? And so we can make use of the pandemic, not to figure out, it's this thing, what's life going to give me? I can't do these things anymore because of the pandemic. But there's another question about like, what am I going to give to life? What do I have to contribute to the world? And if you're struggling with weight, there are a lot of meaningful ways to contribute to the world, because there are many other people suffering with the same thing, who need that village of support, who need people to say, it's not just you, right? Yes. And that's a very meaningful contribution to the world.
That is a beautiful way to put that. And I will also say, I know a lot of us have embraced what people are calling doom scrolling during the pandemic as well. And I think that is another moment where I'm just going to pump your tires again. I encourage everybody to follow Dr. Dayna Lee Baggley on Instagram too. Some of the things that you're sharing on social have been delightful as well. Like pandemic brain is real. It impacts memory and a whole bunch of other things I can't remember right now, like little things like that feel incredibly human are great. And I say that because I do think people can improve their feeds as well. As someone who was stymied and thought I loved diet culture, I used to follow a whole pile of people that I actually have unfollowed. And now I'm following people that are more in line with my values than the ones I held before. And I have to say, cleaning up your feed makes a really big difference, especially right now when our feed kind of is where we go to spend our time.
Yeah. And there's lots of data on that, right? That it can be a great way to connect with people, especially if you're isolated or rural areas or, places where you don't have as many people to connect with. But if you're, online with the wrong people, it is very detrimental to mental health.
It fascinates me. Every once in a while, I'll realize I forgot somebody and they'll show up as like a before and after or something. I'm like, oh, that sticks out like a sore thumb now compared to what my feed used to look like. Yeah. And it's kind of refreshing. So I love it. Ian, do we have any other comments or questions we want to bring in? You're on mute.
I'm on mute. No. There was a comment about the kind of going back to the conversation about the medications. This one I think is a question or something that we can talk about on another podcast or webinar about the cost of medications. And so yes, there are things that are accessible to Canadians, not just medications, but other treatments, including psychological interventions and stuff. These things are available, but they aren't necessarily accessible. And I think that's a whole other can of worms in and of itself that we need to dig into a lot deeper, the accessibility of obesity management mechanisms.
So, and some of the things that we do at our clinic, to help with accessibility. So again, we do group treatments. So we do group treatments on things like binge eating and body image, again, to increase access to science-based information. This is not about trying harder, it's about trying smarter. And reducing the cost per person. We also have video only versions of the content. So you're not in like having live sessions, but there are video only versions that again, cost less. I do present, sort of guest speaking at like various medical clinics, like Dr. Lyon's clinic in BC, where there's group medical visits where we're doing like the Healthy Habits Suck as a live kind of way of working through it. So, those are our small contributions to trying to increase access to care, and hopefully, again, kind of offering something that's legitimate and credible and based on science, and that you're going to get appropriate information.
I think that is a really good way to bring this baby home as well, and know that there are tons of resources available. I really do encourage everybody to find Dr. Dayna Lee Baggley on social and check out her website. There are lots of virtual offerings being made available in multiple provinces, as she talked about at the beginning. Also want to remind everybody that OC Connect exists so that we can all stay connected, continue these conversations. Tell us what you'd like to talk about over there as well. We're happy to bring those in. But I can't thank you enough for this hour. This has been absolutely delightful. Thank you for sharing your direct Gmail access to Dr. Dayna Lee Baggley, everybody. So some really big things that I know that I'm taking away, and I hope everybody else remembers along the way as well. Bodies are meant to change, and body diversity is an okay and really good thing, actually. And the way to really navigate a lot of this is to connect to your core values, get back to your why and what's really going to make you feel really good about showing up for yourself all the time. I love that you talked about the cure for burnout, is connection, not just self-care, because there's a big difference in those two things. And that pandemic brain is real. This is really happening to us. We are all under a lot of stress. So find people, connect with people, stay engaged in your health, whatever that looks like right now, because we need each other, and we need this connection to really stay healthy and happy. Amazing. Thank you so much for the time, Dr. Dayna Lee Baggley. Everyone else, I hope we get to see you in the OC Connect community or OC Connect Pro if you are a healthcare practitioner. This session has been recorded, and we will share out the links. Please share with your networks as well. We need this village of happy and healthy humans. So until the next one, everybody, please take good care, wash your hands, be kind to yourself and at least one other person today. All right. Thanks, everyone.
Thank you.